Having been in your shoes before, I know how difficult it is to choose what dental school that you want to ultimately attend, and especially because choosing what dental school you want to attend is a significant decision that's going to shape your future and essentially lay the foundation for your dental career. So in this video, I'll talk about factors that I considered when choosing between different dental schools that I was accepted to and why I ultimately chose to attend UCLA School of Dentistry. It's ultimately up to you how much you value the different factors I considered and the ones that I talk about in this video in deciding what school you should attend. But really, hopefully this video should help you determine what factors to consider in general and what's important about each point. If you're new here, I'm Dr. Andrew. I'm a dentist who has served on the advisory board for the dental school application, AADSAS, and I'm passionate about mentoring pre-dentals and helping pre-dentals get accepted to dental school. One of the first things that I considered when looking at the different dental schools that I was accepted to and choosing which dental school to attend was the school culture and the environment. And what I mean by that firstly is looking at schools and whether they are competitive or collaborative. For example, there are some dental schools that are notoriously known to be very cutthroat, and the students at the school are known to be very competitive with one another. And there's other schools that help create a more collaborative culture or are known to be more collaborative and friendly. So for example, both UCLA and UCSF were pass-fail schools where instead of getting a letter grade, you were on a pass-fail basis. There technically was also honors, but at UCLA, we were not ranked. So being on that pass-fail honor system really helped create a collaborative environment where students were willing to help each other more and give each other tips and tricks and really help everyone succeed, which was something I valued a lot and I'm really thankful for in terms of that collaborative nature, helping reduce the stress of dental school since it is already so cutthroat. Another factor I considered and ultimately made me choose UCLA was faculty. So at UCLA, I knew that there are faculty who have come from all over the world and are at the top of the industry from all over the world who wanted to come to UCLA and were teaching at UCLA, and I could learn from those people. So it led to a really high quality of education, and that's something I valued a lot. The second thing is a lot of the part-time faculty at UCLA came from nearby cities like Beverly Hills, Brentwood, and Santa Monica, which are really high-end places to be practicing dentistry. And the dentists who I had who were part-time faculty at UCLA made it so I was able to learn from really experienced clinicians who knew the tips and tricks and other ways to do things that made me learn a lot better clinical skills. And that leads me to the third point, which is clinical experience. So one of the things that I considered was, when am I going to get into the clinic? So there are dental schools that will get you into the clinic in the end of your first year. There's a lot of schools that get you into the second year like UCLA did. And there's some schools that you won't even get into the clinic until your third year. Of course, the sooner you get into the clinic and actually treating patients and working with patients, the more clinical experience and clinical skills you're likely to build and get, which is ultimately what you need to provide high quality patient care in the real world, in the clinical setting. As part of clinical experience, you might also consider, is this a school that's more research focused or clinical focused? So some schools focus really heavily on didactics and even research, while other schools are doing everything that they can to get you into the clinic and gain that clinical experience and as much of it as soon as possible. And to add another layer onto the clinical experience, you also want to consider what kind of clinical experience you get. For example, at schools where there are a lot of residency programs for the different specialties, you are likely to get less experience with cases in the clinic within those specialties. So for example, a lot of the oral surgery cases like extractions were sent out to the oral surgery clinic at UCLA. However, at schools where there may not be an oral surgery residency at the school or other specialties, you're probably gonna take on that case yourself and do that extraction. Now, you can definitely go into these specialty clinics, or at least at UCLA, we were able to go into the specialty clinics and get hands-on ourselves, but it did add that potential layer of you not getting to do that case. Before we go on to the next point, if you're finding this video helpful, give it a like and subscribe for more helpful pre-dental content. Another factor that I would consider are specialty match rates. So if you want to specialize, then you're going to go through a process where you have to match with just one residency program. You do not get a lot of acceptances or even more than one acceptance when it comes to specializing and matching with the school. So matching is very competitive, and you want to know, if you want to specialize, how many students from that dental school that want to go on to specializing actually match and get into residency. That's something that you can ask the faculty or the admissions office or even students on the student panel when you are interviewing at that school. It's definitely something that I would think about if specializing is something that you're considering. Something else that I considered and meant a lot to me was location. So people typically think about proximity to family and friends, but also think about the other factors that location can affect, like lifelong mentorship. And what I mean by that is, if you get to know faculty or part-time dentists who come teach at the dental school while you're in dental school, those can be lifelong mentors to you. And they'll be especially useful in terms of being able to maintain that relationship if it's a place where you end up practicing near. So let's say if I went to UCLA and developed these relationships, it would mean a lot if I practice in Los Angeles, because those mentors are still in my proximity. I could still grab lunch with them or dinner and continue to get that mentorship from them. So that's something that you may want to consider, as well as job opportunities. So think about where you want to end up in 4 years or 5 years when you finish dental school. Are you open to anywhere, or do you really want to go and practice in one particular city or state? It could be really helpful to go to a dental school in that city or in that state to build a potential patient base or that networking community or whatever it is, if you want to end up in a particular city or region. Another factor that went into me choosing UCLA, and maybe something you want to consider, is the cost of tuition. So I don't think that tuition should be the sole determinant of where you end up, because there are some really expensive dental schools that provide a really great quality of education that can best prepare you for real world dentistry. And that's something I view as a very worthwhile investment. But depending on how much the cost of tuition matters to you, and the fact that it can vary widely, and living expenses may also add to your tuition costs, you may want to consider these different things. So for example, do you want to be in a big city like Los Angeles or New York City, where the cost of rent and just attending a dental school in that city is going to be a lot more expensive compared to a lot of other areas or smaller cities where the cost of living is a lot lower? So between the cost of actual tuition and fees and with living expenses like rent, consider the total cost of attending a dental school. And for me, UCLA was my public school, being born and raised in California, and the tuition was an absolute game changer in how big of a difference it made to attend a school like UCLA versus NYU, for example, where there was a gap of almost $200,000. Another thing you may want to consider is class size. So at the low end, we have Harvard, which has a class size of about 35 students. And at UCLA, we had a class size of about 88 dental students, which is pretty normal in terms of being around that 80, 90, 100 class size range. And being at that 80, 90, or 100 class size range is definitely a lot more normal. So you may want to consider the class size, because the more students that there are in your class, the more opportunities you have to find your perfect buddy to study with late at night, or that perfect friend who you can really connect with and go through dental school with, or the group of friends. And depending on your situation, that may mean a lot to you, or that may not mean a lot to you, but it is something that I'm happy about in terms of being part of a dental school that had a large class size, where there were a lot of people with similarities and similar hobbies, and people who I could get along with and go through the rigors and challenges of dental school with. There's also factors like the name brand of the school, or even the school rank. And if that's something you're considering, you'll want to check out this next video on the best dental schools in the US to help with that process.